Excuse me. So, hi guys, my name is Olivia, and this is my critical appraisal on the clinical utility of a cluster of tests as a diagnostic support tool for clinical lumbar instability. So, for the search strategies, I used PubMed and I searched terms clinical exam and lumbar instability, and that yielded me about 40,000 results. And once I narrowed it down to articles within the last 5 years, English, and those focused on humans, it gave me about 16,000 articles. So the objective of this article was to determine the accuracy of clinical examination tests in the diagnosis of chronic lumbar instability. So for our PICO question, the P for patients would be those with suspected lumbar pathology or low back musculoskeletal conditions. The I for intervention would be physical examination. The C would be diagnostic imaging as the comparison. And then the O would be for outcomes, diagnosis of chronic lumbar instability given the physical examination and the diagnostic imaging. So this is a prospective cross-sectional study, which puts it about level one, maybe even level two of evidence. And for the patients that they used, the inclusion criteria were those with chronic low back pain aged 40 to 60 years old, patients at the specific hospital that this study was enrolled with. So the hospital was actually one in Thailand, and then those suspected with lumbar pathology. For exclusion criteria, those that were previously diagnosed with spinal pathology, such as spondies, nerve root compression issues, stenosis, etc., they were excluded. And then those women who were pregnant, and then those once again with neurological symptoms. So for the methods, it was actually kind of cool. So a physical therapist performed a standardized physical exam for all of the included participants. And this exam consisted of a thorough history and then special tests that were performed. And so they were sort of diagnosed based off what they think their condition was, just based off the physical exam by the physical therapist. And then participants were examined for lumbar instability via diagnostic imaging. This article used specifically radiographs and just radiographs to my knowledge. And these were I observed and diagnosed via an orthopedic surgeon. So they looked at their images and they, along with like a thorough history, kind of determined what they think the diagnosis was. And so the results were compared between the physical therapist and the orthopedic surgeon. And what we see here is that for apprehension specifically, and apprehension was defined as the feeling of the lumbar kind of collapsing during activities of daily living, which is why it was used as more of like a clinical finding rather than a special test, because nothing's actively performed. It's just whether the patient felt like their lumbar spine was collapsing during ADLs, with lumbar flexion and lumbar movement. And so this article counted that as a positive sign if those that had the apprehension had felt it at some point within the last 7 days of examination. So based off of apprehension alone, the sensitivity and the specificity are 17 and 93%, which gives us about a 2.4 and a 0.9 rating for positive and negative likelihood ratios. And I gave this article an 11 out of 14 for the Quadis score. So the results show that signs of apprehension were not a great predictive value in diagnosing lumbar instability. Like I had mentioned and like I showed previously, these likelihood ratios are not the best numbers and not things that we want to see and be confident in and using as a way to rule in and rule out certain conditions. And I certainly wouldn't use apprehension as a clinical finding as a tool to do so. And so, like I had mentioned, I gave this an 11 out of 14. I thought it was a pretty good article. There were only two things that were pretty unclear to me, which was like, were the test results interpreted without knowledge of the reference standard and of the index test? They just like weren't, it wasn't clearly specified in my opinion, which is why I gave it an unclear, and then a straight no where it talked about were uninterpretable test results reported. I didn't find that within the article, but everything else I thought was pretty clear and really, really easy to understand and get through. And so the take home points is that apprehension alone is not a good clinical prediction tool to rule in or out lumbar instability. I think apprehension is a great maybe history question to ask and something to note, but I would not hang my hat on it as a way to predict certain conditions, specifically in this case, lumbar instability. Thank you and have a great day.